Lowcountry doctors say the impacts of COVID-19 will impact the medical world for years to come. News K Press Tech caught up with physicians to hear how the virus has altered protocols and how long they could be following guidelines like masks and social distancing.
Doctors with Roper St. Francis say as of right now, hospital procedure is showing an indefinite continuation of mask wearing and social distancing in a clinical setting.
I have close friends who have had serious illness and even death from this. This is real.
Dr. Stan Wilson with Roper St. Francis says the pandemic has changed the way hospitals operate.
And this is not our first rodeo.
And now they're learning from history.
I mean, how long has tuberculosis been around? Forever. You know, malaria in other countries and other climates, that we haven't ever been able to cure that. We've been able to control it to some degree.
Each disease teaching the medical community how to better their care.
Bad staph infections. They were a plague years ago. We have it controlled, but we haven't been able to back off on the things that we know keep patients safe.
Whether an epidemic or pandemic, Dr. Wilson says he looks for the positives. For COVID-19, it's the increase in hand washing and social distancing, among other hospital improvements.
To improve the ability to have negative pressure where it's appropriate, to suck bacteria away from the patient and the rest of the hospital. And I think this is going to have changed forever many of the ways we have cared for people.
Dr. Wilson says that another positive to come from this pandemic in a clinical setting is the increase in virtual care. In Charleston, I'm Kate Prestach. Count on 2.